I have type 1 diabetes myself, and I've been having that since I was 15 years old. I have a continuous glucose meter here. So before a meal, I'm scanning my blood glucose. I have to judge on the meal how many grams of carbohydrates this is, and then I'm deciding on a dosing of bolus insulin for the meal. So that's a typical decision, and I have to do that calculation manually.
The standard procedure with type 1 diabetes is that you would meet your clinician, meaning your doctor, like once a year or perhaps twice a year. From the patient perspective, what you really sort of are seeking assistance with is mostly how to manage your insulin treatment. But at most of the patient visits, that type of questions can only take up 5 to 10 minutes because there's so much else that you need to go through. And now, since there's been a development of continuous glucose measurements, we now have a lot of data available on how to actually advise on how to administer insulin, because we know your exact glucose profile. But we're lacking the time on going through that data. So if you see your patient once every year, that means it's more than 50,000 data points. So that's why I think we really need these type of tools that we're now developing that will automatically analyze all of those data points, highlight those that are of particular interest, and also give advice on how to optimize that type of treatment for those specific events.
So in my clinic nowadays we have 80% having these kind of glucose monitoring systems. I believe that this system will be of tremendous help for doctors and nurses in healthcare, so that they in a reasonable amount of time can judge and analyze the weaknesses in the glucose control of the patients, and this tool that we develop will provide such guidance.
The dream scenario is actually that this will be an integrated part of insulin-treated diabetes globally.